Thank you, David. I would now like to introduce Alison McMillan, PSM, member of the Australian College of Nursing. Alison is the Commonwealth Chief Nursing and Midwifery Officer, a position that she has held since 2019. And Alison's going to talk to us today about strengthening the sustainability of the Australian nursing workforce. Please join me in welcoming Alison McMillan.
Good morning. I'm a wanderer, so I've got this fancy piece of gadget on my head. Can I also first acknowledge the traditional owners of the lands on which we meet today, the Ngunnawal people, and of course we've had that great welcome from Auntie Violet today. It's my privilege to be here to talk to you. It is the first full sitting day of Parliament, the second term of the Labour government. Many of you may have heard me say this before, but I'm going to say it again. It's important that you understand what my role is. I'm the Chief Nursing and Midwifery Officer, and as you can see on my slide, I'm a little provocative because I'm going to talk about nursing and midwifery. I know this is the National Nursing Forum, but we are intrinsically linked together, and we need to maintain that bond. And I know many of you out there probably are midwives and nurses. Primarily, I'm a public servant. I work for the government that you elected. So whilst I provide advice to government in relation to nursing, midwifery, health policy, aged care policy, and all the things that go with that, it's important to understand that I do advocate, but there are times when I need to follow the rules, and I might give the most strident advice to Mark Butler. But sometimes the government will make decisions that are somewhat different to what the advice would be, and that's my job to then implement their policies. But I do work in partnership with all of the colleges, particularly the College of Nursing, and we work together in different ways. So Catherine and the team at the College of Nursing can do and say things that I might be limited to do. And it's in those partnerships between I as a public servant and the colleges as the peak bodies that we bring forward many of the messages we bring to government, and as a consequence many of the changes that we've seen that I'll talk about today. The other important thing to remember, and it comes to some extent from our recent visit to Helsinki at the ICN, is that I believe from the other chief nurses I've spoken to across the world that we, not me, but we, have the most senior position in government filled by a nurse, a role for a nurse. So the Chief Nursing and Midwifery Officer in Australia is called a First Assistant Secretary, a very senior role in government. And that is the consequence of work of those who've gone before me, from Rosemary Bryant and from Deb Toms, who's here in the audience. People who fought hard and made cases to government to say, if you want to see nursing and midwifery represented in the public service, then it needs to be at the most senior level. And that gives me the ability to influence in a way that many of my other international colleagues simply don't have. And there are many chief nurses across the world who don't have that ability to speak to government. And we need to remember that those that pushed for that, and we sustain that, and we see it's important. The other thing I want you to know is that today there isn't a major policy decision-making meeting held without nursing being at the table. Catherine is at the table of a very senior meeting pulled together by Blair Comley, the Secretary of the Department, on the viability of the private health system. We do know that our private health system is challenged. We've seen what's happened to Healthscope. And there was clear recognition that senior nursing leadership needed to be at that table, and Catherine is there. You may have heard, with this second term of government, discussions around the productivity of Australia. Our productivity is dropping, and there is concern about what that means for our economy. And once again, in the productivity forums that will be held in the next few weeks by the Treasurer, we will see nursing and midwifery organisations at those tables, looking particularly the ANMF. Obviously, they're very influential as a union. But again, we have the nursing and midwifery voice very clearly centre of these things. So I think we are very well positioned for our future. I just have to check on my notes. I can't do notes without my glasses. Okay, green button apparently. Okay, this, I'm sure you've all seen these sort of things before, is our placemat. This is the Department of Health, Disability and Ageing. We got a new bit in our name, and we are drawing a disability into our work. I'm not going to go into detail, you can see this on our website, but this is really setting the direction for our department. It is in one place where you can see what our priorities are. And those four strategic priorities, I think none of us would disagree, that are vital parts of what we believe is important to people, to patients, to consumers. And interestingly, those four themes were very strong in our consultation for the National Nursing Workforce Strategy. So we have strategic alignment in our strategy in relation to the work of the department. Early this year, there was the release of the most recent report of the state of the world's nursing. This is the data provided by Australia, then represented in this way. It represents where we are in relation to the rest of the world. I think 140 countries contributed data. Obviously, we have sophisticated data systems, particularly thanks to the work of AHPRA and the NMBA. And again, this shows you a little bit about Australia, and we did use this in Helsinki. And you can see, of course, as we all know, a lot of us and most of us live on the eastern seaboard. And it's a representation of our nursing workforce in comparison to other countries. One of the things that was incredibly apparent in Helsinki was how well represented Australia was. And there are people here in the audience who spoke, and many of my colleagues who were here were there too. When you talk to colleagues across the world, people look at us in awe. Australia is so strong in its nursing leadership. It's seen as the place that's leading the world. We saw Jill, who will today talk to you about the new definitions that she and others have been working on. Strong Australian leadership. We saw Shelley presenting with others on the importance of nurse-to-patient ratios and the influence that has through now really good evidence to patient outcomes. And many of the other innovative things that we have in Australia that make us leaders in the world, that others look to us. And we know many people want to come and work here as nurses. So I made the organisers of the conference very nervous because I only gave them my presentation last night. Is it coming? Is it coming? Yeah. The reason was I was waiting for this. This is hot off the press. So a great team led by a good friend of mine, Maureen McCarthy, in the department, crunches the numbers on our data, and this is 2024 data. And it's there for you to see, and it will be published shortly, and you can see it in more detail. So this, and I've included nurses and midwives in this because again, we really bring together still that partnership, that sisterhood. And this is the 5 years of data going backwards from when I commenced in the job, as Karen said, in 2019. So the CAGR is the compound average growth rate over the 5 years. And so you can see here, other than in enrolled nurses, we have seen strong growth in our nursing workforce and in our midwifery workforce as well. Significant growth. And I know often for some of you there are shortages and challenges, but this is in light of this data that we are still growing and have continued to see our profession seen as something people want to do and want to sustain in. And this is really very heartening to see that we are continuing to see growth over time, over the last 5 years. some of the details that are not on there, but I'll share them with you. We saw a 5.9% increase in growth, annual growth, on the number of employed nurses. So with all data, as I'm sure you're familiar, there's the number of nurses that are registered, but there's also the number who are employed, because that's really an important part of understanding our workforce more clearly. And so we saw a 5.9% growth in the number of nurses employed from 2023 to 2024. However, we did see a fall, and very concerning, a fall in the number of enrolled nurses employed by almost 1%. And we need to better understand what that means. We saw an increase in 232 nurse practitioners in Australia, and that growth will continue because, as you know, many of you may well be aware, there are scholarships at the moment available, funded through the government, to study to become a nurse practitioner. And importantly too, we saw an 8.7% increase in the number of employed midwives. So we're seeing strong growth. That doesn't mean to say we can sit on our laurels, because we know that we need more in our future. We need to grow more. We need to train, sustain our training capacity. There is an important part of migration that fulfills our workforce, and I'm an example of that migration, although a very long time ago. But most importantly, we need to sustain and retain our workforce into the future. And much of that is reliant on us. How do we care for each other, support each other? How do we listen and see what we do? How do we act where we see bullying or bad behaviour? Because it's important to us, and it is incumbent upon us to act where we see those behaviours, because we all know they're still out there. And I want to share an experience for me, which was a very emotive experience in recent times. I was fortunate enough to go to the Katzenham conference in Thursday Island. And there was a session by Aboriginal and Torres Strait Islander nurses and midwives about the challenge of the cultural burden. And it was a really powerful message, because from their heart they talked about the challenges that exist for Aboriginal and Torres Strait Islander nurses and midwives in Australia. There's the experience that was, again, shared with me last night, the tendency to say, oh, this is an Aboriginal and Torres Strait Islander patient, you're the Aboriginal and Torres Strait Islander nurse, they're yours. The burden that's carried through not the burden, but the obligations that are required as part of family and kinship, and those things that are very much part of the culture and very intrinsically part of their lives. And we need to recognise how important that is. And so next time when you're working with an Aboriginal Torres Strait Islander nurse or midwife, just remember that they carry some enormous challenges in meeting their professional needs and their cultural needs and their personal needs too, in some of the complexity of their lives. And if you do get a chance to hear some of those stories, then really important to do so. Thank you to all of you who contributed to the development of the National Nursing Workforce Strategy. Many of my chief nursing and midwifery colleagues are here in the audience today who have led this work, and particularly I acknowledge the work of Carrie Long in this work. It is now a little stuck in the bureaucracy, getting through to publication, but we are very close. And due to the sophistication of the team that I work with, you can see here there's a QR code. So if you want to know more, you know what to do with a QR code by now. Remember in 2019, QR codes? Get in the bar? Luckily that's gone. What other things have been happening? So, since 2023, we've had a nurse practitioner workforce plan. 18 of the 25 recommendations are either already completed or well underway. So what I want to help you understand is that we don't write plans anymore and put them on shelves and say, tick. We work through finding ways to remove some of the barriers, particularly for nurse practitioners and endorsed midwives, particularly, for instance, collaborative arrangements. And the great team that helped lead this work continue to do so, and we see nurse practitioners go from strength to strength. And of course, the nurse-led clinics here in Canberra have a large proportion of those are led by nurse practitioners, but we are seeing a continued growth, as I said, in this important part of our workforce. For some of you, RN prescribing may have come a little bit as a surprise. But designated registered nurse prescribing is now a reality. The standard is complete and published, the accreditation standard is developed, and universities are starting to develop the training necessary to become a designated registered nurse prescriber. The other thing that's really interesting is that the colleagues I work with in primary care, the Royal Australasian College of General Practitioners, and the AMA are excited too. I'm a bit suspicious, but I think they can see the advantage of the partnerships of what doctors and nurses work so closely together, and this is just an evolution of our partnerships. So there will be much to tell you about this into the future. There's much work going on at the jurisdictions about how this is going to work and how it will be implemented. We're working with the board very closely because, to be honest, we don't have all of the answers right now. This is quite significantly big reform. We've been waiting for it for a long time, and now it's scurried up quite quickly. For me, there are some in the federal government, there are changes we need to make to legislation, which is never simple, but this is coming. Get on board, get thinking about this, because this training will be available before long, and this will bring, I think, a really significant change to the way we work and the way that we can meet patient need into the future. David spoke earlier about a number of the reviews that are going on. So on one side here, Strengthening Medicare Reviews, you can see some of the reviews. And for us, I think, unleashing the potential of our health workforce, or a scope of practice review, as it's often spoken about, is really important. If you haven't read the report, please do. Written by Mark Colmack in collaboration, but with enormous consultation. So really, really great piece of work. We now have a task force in the department. So on the far side here, you can see that we're working with this task force to bring about these changes. And we have scooped designated RN prescribing up into these reforms because it gives it momentum. It gives us influence and the ability to see the necessary funding support we'll need to make these changes work. But there are many reforms that are going to be important, particularly in the primary care space, that we will see into the future, that are very much a part of the reform and the department that I work with. And you will hear that mentioned many times by ministers across the system. One of the other things that my office has been doing, and I bring this to you for an important reason, we have been enabling private practicing midwives to work more to their full scope of practice. You might say to me, why is that important to me? I'm not a midwife. Because what we're doing here is work to improve access to care, particularly for women in sexual and reproductive health. We've heard, and you will have all heard well by now, the inequity in many parts of our women's lives, whether it's endometriosis, whatever it might be. There is a significant inequity in health access and accepting many of the challenges we face as women, and that is changing. And also about birthing choice. So enabling privately practicing midwives to work to their full scope is important, for instance, in birthing on country, where we're seeing some really positive outcomes in Aboriginal and Torres Strait Islander babies and women in maternal care. Really, really important, and we'll see more of that into the future. And giving the women choice to birth at home, or to stay longer with the support of a midwife in their intrapartum period of care, in early labour, at home, and only needing to go to hospital when birth is close. So some of these things, obviously the removal of collaborative arrangements was a landmark decision and a very exciting day. But giving more access to the Medicare benefit schedule so that they can bill better and charge women less. A massive increase in the number of drugs that they can prescribe on the PBS so that women are not needing to either then go to a GP to get prescribed under the PBS or have to pay. And certainly importantly, leading better access to midwifery continuity of care. So in a female-dominated profession such as nursing, these are important things for us as women, to be giving women more choice about their future and their health care. So an important work and very much a partnership with the Australian College of Midwives. Another exciting piece of work that I encourage you to see is the National Lung Cancer Screening Program. This is the first screening program in quite a number of years, a massive investment. This is so important. If we catch lung cancer early, it is treatable. And survival rates with early detection are so important. And so there's a 2-yearly screening program based on a patient's risk. This is groundbreaking. But some of the exciting things about this is, for the first time, I have to tell you, we didn't need to really argue, although Frances Rice, who's in the audience here, who is part of the development of this program, is that there was an acceptance that nurse practitioners should be able to order these investigations just as part of normal healthcare delivery. And I think for me that was one of the first times we simply saw, yes, nurse practitioners should be able to do this just like GPs can. So we're seeing that change where before we might have had to push hard and make a case, there was a simple acceptance that we are part of the primary healthcare delivery team. And so the lung cancer screening program is a part of that. And this work I think we'll see, particularly for Aboriginal and Torres Strait Islander people for whom their burden of lung cancer is much greater. So that's me. I was asked to give 10 minutes for questions. I'm a little over time, but I'm understanding we get questions on the screen, Karen?
Alison, as a question, I think that one's a really good one.
I do produce a newsletter, and if you scan the QR code, you'll see my newsletter, and the newsletter is an online newsletter, and will tell you a lot more about some of the things I've talked about today.
That's absolutely brilliant. Thank you so much, Alison. There is so much going on that we can be excited about, isn't there? It's just absolutely marvellous, and we thank you so much for all of your hard work. As for questions, the questions have to be submitted via the app, and as the MC, I've got actually no idea what happens then. There might be people out there putting things into the app right now, Alison, but I can't see anything.
Oh, Karen, we've been all friends.
Yeah, okay.
We're pretty adaptable, aren't we?
Yeah. Oh, here we go. Oh, look.
Something I prepared earlier.
Something Kath prepared earlier. All right. No, like the swan, elegant above and paddling furiously underneath.
I don't think anyone's ever called me a swan.
Huh?
A clump, but not a swan.
Well, let's just move rapidly on. There is a question here from Lucy Osborne would like to know, in sharing these statistics about the workforce, do these include those leaving the profession? So I think what Lucy's interested in is what's our exit rate currently? We can see a growth in people coming into the profession, but is the profession as a whole increasing?
No. Exit rates are quite stable. I do have that, but I didn't put this on. Yes, we do always see people leaving our profession, particularly in my generation. People are choosing to retire. But there is no mass exodus, as many have suggested. And in fact, drawing from just memory, because I only got this data yesterday, I think the exit rate for 24 is less than 23. And again, sometimes this is careful. It's about, are people moving off the register into non-practicing, or are they choosing to work less hours? There is a myriad of things that we know about our workforce and its complexities. So no, we're not seeing mass exodus. We're not seeing that in any way, but we will always expect to see, particularly because of the baby boom bubble, we would expect to see those. But people are making choices. We're a very part-time profession now, for many reasons I'm sure we all understand.
And I think one of the things that we need to understand when we talk about exit rates and things is also the broader environment in which nursing functions. So if you go back to things like the global financial crisis, we saw an increase in rates of employment of nurses because, of course, in a family where you've lost one income, a nurse can easily pick up extra work. And so in the current environment with the cost of living crisis, we would also see those same sort of factors playing out with nurses increasing their hours to maintain the family income. So it's actually not as simple as we think it is to crunch these numbers at times. We have to look at a whole range of other factors. Speaking of which, I've got a question here about the direct transition of enrolled nurse graduates to bachelor level education. So the thing being here is, are we seeing less people enrolled as working and employed as enrolled nurses because they're going straight back to university and transitioning into a registered nurse program?
I don't know.
The answer is we don't know.
We don't know.
And it's a piece of data we've been trying to get for some years now to try and to understand that. We know that a lot of these people will complete their enrolled nurse course and work as an enrolled nurse whilst doing their registered nurse course. We know that's a pathway, but getting the exact numbers is tricky.
So, as we all know, we had a new way of registering this year, and we'll all accept there were a few ripples in that system.
Yeah, I think Veronica's looking forward to her
Veronica's smiling
question
over there. Some were big humps, but ripples. The fabulous thing is that now AHPRA are going to have a much more comprehensive data set, and hopefully a data set for which we can do much, much more analysis of this going forward. And one of the things that I and my Chief Nursing and Midwifery Officer colleagues here have been working with Veronica and advocating for is student registration data. So registering students at the beginning of their career and being able to follow you throughout your career with a single identifier. We don't need to know who you are, we just need to know more about your journey. And we're hopeful that now AHPRA have developed this much more sophisticated data set, that in the future we'll have this type of information that can better help us understand what the life journey is in a career. And I'm sure Veronica's hearing that plea just now.
Yes, and I think that would, it's all about the quality of the data, isn't it? And the more that we can do to improve the quality.
That's right, and that's why it's so important that you complete that survey that comes when you re-register, because that's where we get the richness of information. And the more accurate you can be and the more you take the time to complete that, the better we and our colleagues can then be in really analysing what the data is telling us.
This board is lighting up with questions. More questions than we've got time to answer because, in fact, we've run out of time, unfortunately. Are you around for a bit longer, Alison?
I'm coming and going in the next couple of days. It's the first, as you can imagine, there's a lot of work to do in the first week back into Parliament, and this is what we would call the period of maifo. This is the period of time when we're looking a lot at budget and expenditure, and I need to be at the table to make sure we get our share. But I will come and go, so...
All right. Well,
happy
I think if you're happy for people to come and approach you.
Of course.
Yep, lovely.
Always.
Thank you. Thank you, everyone, for these marvellous questions. And thank you, Alison. This is the part where I walk across the stage chasing the speaker, saying, we've got a gift.
Thank you.
Thank you, Alison.